Hi everybody, my name is Janice Booth. I am a doTERRA respiratory wellness advocate and I am also a certified respiratory therapist. And today I just want to take a few minutes and talk about 3 oils that are great for our immune system. Around this time of the year, it's damp, it's cold, and those are the 2 things that can trigger bronchospasms with patients who have respiratory compromised systems, like asthma, COPD, emphysema. So the first one I want to talk about today is Breathe. And Breathe is a mixture of oils that are great for our respiratory system. It's an anti-spasmodic and it's anti-inflammatory, which means that it'll help smooth the muscles in our bronchioles and help decrease the symptoms of bronchospasms that can trigger the coughing and the shortness of breath with people. The next one is frankincense. And this is an amazing oil. It is also an anti-inflammatory, so it helps decrease the inflammation in our lungs. And it's also an expectorant, which means it'll help us be able to cough up the mucus and phlegm that we have that gets stuck in our lungs in this time of the year. The next one is cinnamon, and cinnamon is an amazing oil. It's so good for our respiratory system. It's also an anti-inflammatory and it's an anti-spasmodic, which means it'll help with those bronchospasms, and then again you get extra support with the inflammation that you can experience in your lungs. One of my favorite ways to use these oils at this time of the year is to use topically. And my favorite carrier oil is organic sunflower seed oil. I get the GMO free and of course the organic because I want it as pure as possible. I can get it at my local grocery store, and you should also be able to find it at Walmart. I put some in the palm of my hand. I add one of these oils, if not a drop of each one. You can put it on the bottoms of your feet, you can rub it on your chest and your back, and you can also cup your hands, put it to your nose and your mouth and inhale it. Another way that I absolutely love using these oils for our respiratory system is called a steam treatment. This is where I warm up water in the microwave 3 or 4 minutes. I put the drops of oil. The last one I did 2 drops of frankincense, 1 drop of Breathe, and 1 drop of cinnamon in a glass bowl. And then I added the hot water. I then put a towel over my head and placed my face over the steam that's coming out of the bowl and created a tent with the towel, so the towel covered my whole entire head and the bowl. And I sat at the kitchen table and I breathed in the steam for 3 or 4 minutes. I recommend you do it as long as you possibly can. If you need to take a break, then that's fine, but it'll help get those essential oils into your lungs and directly to the area that needs to be treated. It's wonderful. You can do it 3 or 4 times a day or as needed. You can apply it topically with your carrier oil as many times as you need to. You can also take the frankincense and the cinnamon internally. I love to put a drop of cinnamon on my coffee grounds in the morning when I make my coffee. You can also add a drop to some warm water for cinnamon tea if it's not too strong for you. You can also put them in a veggie capsule, and doTERRA sells them. It's 1 drop of frankincense and 1 drop of cinnamon, and you can take it internally just like you would any over-the-counter medicine. Thank you for joining me today. I hope this gives you an insight of a couple oils that you can use for your respiratory problems, especially this time of the year where we have a lot of coughing, mucus, and we experience bronchospasms because of the cold and the humidity. You can find me on Facebook or you can Google me. It's Janice Booth, doTERRA Respiratory Wellness Advocate. If you have any questions, please send me a personal message on Facebook. I'm also on WordPress, Pinterest, LinkedIn, and Instagram. Hope you guys have a good day. Bye.